The University of Medicine and Dentistry of New Jersey celebrates a rich legacy of service to New Jersey and the world.
I am Jim Oleske. I'm a pediatrician, trained here and stayed here for my whole career, so I'm into the 45th, I guess, year if you count medical school. As a specialist in pediatric allergy, infectious disease, immunology, I would see occasional tough cases, but all of a sudden I was seeing many children that looked like they were suffering from an inherited immunodeficiency and had no idea why. You don't have epidemics of genetic diseases. And it finally dawned on me through more happenstance and luck that a little girl I took care of that died of this strange immunological disease, I thought. When I told the father about the death, we talked for a while. And then 6 months later at St. Michael's, I get a call from their adult ID clinic saying, "Jim, you're good at drawing blood. We have a man here who needs to have a blood for that new test you're developing." During that time, I was doing lymphocyte markers, which was the only study that could identify the suppressor cell, helper cell ratio with the high suppressor cell and low. And I did it by hand. This was not done by mechanics. It took an hour to do each specimen. So they called me to draw blood from a gentleman who was very sick and they couldn't get a blood sample, and pediatricians are good at blood drawing. And so I went down, and as I was drawing his blood, he says, "Dr. Oleske, you don't recognize me, do you?" And I didn't. And I said, "No." He said, "Don't you remember you took care of my little girl who died about 6 months ago? That new disease, you didn't know what it was. You thought it was maybe inherited." And by then we knew that gay men in New York and some drug users in New Jersey were getting this new disease called GRID, gay-related immunodeficiency. And I said to myself, that's what his daughter had. And then we went back and started looking at all the kids we were caring for then, and it was clear that they had this AIDS. There's a lot of people who fought that. People were angry almost that you would say children get this horrible disease. People were very comfortable early in the epidemic. If you were a gay guy or you were a drug user, you were sort of a throwaway. But then it hit the hemophiliac population and it became a real tragedy. And at the same time it hit the hemophilia population, I realized that infants were getting it from their mothers who were infected. And that was a key recognition that a lot of people didn't want to believe. Because if a baby could get AIDS, then maybe anybody could get AIDS. It was a tragedy because most of those children in the early days died. The real joy that came, and if you were to ask me what my contribution to the health field is, was recognizing that. Immediately we realized that we needed to treat mothers who were pregnant who had this disease and see if we could prevent it to their children. And that wasn't well received because you usually didn't treat pregnant women with drugs, especially the only drug we had, AZT, being an anti-cancer drug. And that led to a lot of protest, a lot of controversy. But eventually, the very first woman to get AZT on clinical trial to see if it worked was here at Newark. Arlene Bartigas was the obstetrician and I was the pediatrician. The mother agreed, took the drug. 3 months later, I was a good enough pediatrician that I knew this baby wasn't infected. She looked too good. She didn't look sick like she had anything wrong with her immune deficiency. That was another aha moment. I said, my God, we can prevent this. And now we know if mother is infected and becomes pregnant, if we treat the mom and give the baby some meds early at the time of birth, we have no new cases. We could actually prevent this horrible disease in infants. And that's a legacy I want to always remember.
We celebrate the many accomplishments of UMDNJ and eagerly look forward to further achievements that lie ahead.